So welcome and thank you all for joining us today, the Arizona Daily Star Opinion team, for our Thursday Zoom chat. I am Sarah Brown, the Opinion Coordinator, and I am joined by David Fitzsimmons. Welcome, Dave.
Hi, thanks, Sarah.
Our special guest, go ahead.
Go right ahead.
So our special guest today is Lori Harger, a nurse practitioner providing integrative and holistic psychiatric care in Tucson. And she works at the Centered Spirit program of the Pascua Yaqui tribe, helping individuals that are dealing with addiction, trauma, and severe mental illness. And on top of all of that, she also teaches heart rhythm meditation and mindfulness to graduate students at the U of A. So we welcome you, Lori, and we're so glad to have you here.
Thank you. I'm glad to be here with you all.
So we'll have you kind of introduce yourself a little further and talk more about what you do. But like Fitz had said at the beginning, please feel free to ask questions, whether you raise your virtual hand or put the questions in the chat. We want you all to participate, and we'll enjoy having Lori here to answer as many questions as we can to her. So go ahead and take it away, Lori, and tell us a little bit more about yourself.
Well, thank you. Geez, where to begin? So I feel very flattered that you would ask my opinion, and I feel like this is such an important time. I think it's always an important time to discuss mental health, because you can't have health without your body, mind, and heart being aligned. And this year has been a real a doozy for maintaining that sense of balance and mental health. So I think that it's hard to find benefit in the trials that so many of us have gone through during the pandemic, but I would count it as one benefit if it helps us talk more in more creative ways, opening the door to new ways of understanding mental health and how we can all attend to our own mental health. We don't have to take our health and hand it over to a so-called expert. We are all ultimately the experts of our own health and our wellness, and the first ones to know if things aren't really going as we would hope that they could go. So that's some intro. And I saw a question pop up.
Yeah, Kent asked, he said, welcome, Lori. And he wants to know how your training is different from an MD.
That's a great question. And I think it's hard for people to really totally understand the difference there. So I am a nurse practitioner. I began as a registered nurse, and that is the entry into becoming a nurse practitioner. So I worked in the hospital as a registered nurse for some years, but I actually joined it with the desire to eventually go on to become a nurse practitioner. So the official training for that is a graduate program that is heavily clinical as well as didactic. And the approach of nursing is, we do a lot of the same work, obviously, as medical doctors, but it is from a different approach. And nursing has been from the outset of a very holistic and functional approach where we, as a nurse practitioner, have this long apprenticeship at the bedside, figuring out how do we get these medications in a patient? How do we get the patient up and able to operate on these daily functional activities? And thank goodness, we also have people of all different skill levels, and it's great to be able to collaborate. I turn all the time to medical doctor colleagues who have a much more refined understanding of the fine details of pathophysiology and biochemistry. And that's great to have. And I'm not saying that goes for all nurse practitioners. There are nurse practitioners who also really dived deeply into those specialties as well. But that's the basic difference. I didn't do a hospital residency, and I specifically chose not to become a medical doctor because I had young children at home. As a single mom, there was no way I was going to sign up for the long hours of a medical residency. And I've never regretted choosing nursing. It's a very holistic profession. It gives me the freedom to really remain very much in touch directly with clients. I have I'm not as high priced, so they're more willing to let me spend longer time in my appointments with people. That's the basics of the difference in our trainings.
Great. So I'm curious if there's anything, during the pandemic that, just you've never seen, maybe, as you've been a nurse practitioner, some new, trends you were seeing, or just any new things that kind of came up during the pandemic.
Mm-hmm. So much that's been new. I never had any desire, any interest in doing telehealth before. I found Zoom to be a useful thing in terms of different organizations that I belong to with worldwide membership. We would use Zoom. That was nice because we couldn't always get together, but I never wanted to do that to see my clients. I like to sit in person and, be able to offer a reassuring touch on the shoulder when necessary. So that's a huge difference. I mean, what hasn't been different? But in terms of clinical outcomes, yeah, I haven't. I do not work at the bedside in acute care. I have not been helping people through the process of COVID, but I've never dealt with so many deaths of my own clients, as well as being present to my clients, some of whom have lost 8 family members this year. And what's really compounded that is, most of my work is with the Pasquayaqui tribe, and it's very important to be able to observe traditions of how we mourn and say goodbye to loved ones. And when people can't hold their vigils, when they know that the body of their loved one is sitting in the mortuary waiting for there to be time for that burial. I used to work in hospice for a few years, just on a per diem basis. So I wasn't fully immersed into hospice work, but I still have never encountered death and loss so acutely before as this year. And then, of course, when people are facing loss, they turn to lots of coping mechanisms, and some of them are themselves deadly. We've seen a huge increase in overdose rates and lethal overdose rates. And it feels a little bit like trying to work against an invisible enemy, because you never really know where it's going to come at you from next. Those are big differences. Jump in and interrupt me with any.
I'm curious how you
that.
personally maintain your own mental or emotional health, we'll call it. I asked this of my friends who are cops or EMTs, essentially how you deal with despair on a daily basis.
That is such an important question to ask, and I would encourage you to keep asking that. And by asking that, get them to give more answers, because I ask that all the time too. As a matter of fact, a counselor who I really respect uses that as a criteria when helping people to choose a therapist. Like, ask that person what they do for self-care. And if you meet somebody who says, well, I've already done my work, I've already addressed my issues, then you just hang up and call the next number. And it's important because we never arrive at a place where we have fixed ourselves or fixed our mental health. It's a constant process. And so what I do personally is I have a daily meditation practice, and I belong to a community of meditators that it's very inspiring, and it has absolutely given me the depth and the height and the breadth to do a lot of different kinds of work. And I never have to feel like I am at risk for being burned out, honestly, because I have this deep sense of connection. And I'm truly have a sense of being called to this profession because I've dealt with mental health in family members my whole life. So meditation is huge. And then just being able to play and have fun. And I am so fortunate during COVID that I did not have to be alone. I have a loving partner and our children and our animals, and I get up in the morning and I see the sunrise and I love to watch the sunset. And that might sound simplistic, but it's those things that really make life on earth worth living.
We have some more questions, but I just have to share this anecdote with you because it's kind of relevant to the moment. So once a week throughout COVID, I had an 85-year-old friend over who's a great curmudgeon. And the conversation of my mental health came up. And so I told him my history: psychiatrist, ADHD, Ritalin, and depression, antidepressants, treatment, successful therapy, a sense of well-being. And by the time I finish, I look at my 85-year-old friend and he's like he's a cartoon out of the 1950s. He looks at me like, "Oh, I didn't know you were nuts. That's all crazy talk. I don't need that. I don't need to hear your crazy talk. You're fine." And I thought, wow, it really takes a kind of willingness to be self-aware or self-awareness in the first place to want to investigate your mental health. Do you find from time to time you might encounter clients where self-awareness is an issue?
Yes. that might be like the most common issue, I would say.
Wow, how do you use a can opener or a mallet, or how do you?
Yeah, that is a tough one. You know, a lot of it just comes down to maintaining the therapeutic presence, and that is something that, you know, for me personally, I wouldn't know how to do that without my daily meditation practice. And it's as simple as just sitting authentically gazing into the eyes of another person, which is difficult via Zoom, but sitting, and you can do it over the phone though. I've been really delighted how open we can be over the phone or without cameras at work. You're there with them, you provide a space where they feel safe. Oftentimes, people are vastly more aware than they let on, and it's a defense. And if they can, you know, feel safe with another person, they can start to open up a little bit. And I also can honor denial. I mean, denial gets you through hell sometimes.
That's interesting. I'll remember that.
I would like to go back though to what you said about when he said, "Wow, you're not crazy, you're fine." I would say, those aren't mutually exclusive. You can be crazy and fine.
That's fun. Yeah. We got a lot of questions in chat world over here. Sarah, should we have people unmute themselves and ask their questions?
Yeah, definitely. Kathy Scott, you had a question in there. Did you want to go ahead and ask?
Yeah, when I got my master's in guidance and counseling, my internship was with Native Americans and teenagers. And during a very short period of time, 2 of the teenagers committed suicide. And this was 35, 40 years ago. I would imagine right now the rate is really up there, Lori. Can you talk a little bit about that and how you deal with the mental health tsunami that one suicide can cause?
Mm-hmm. Yeah, that's a great question. And there's not an easy answer except to say, well, yes, suicides have increased. I will admit I'm not a good numbers person. That was one of my challenges with COVID, checking numbers every day. I don't know how much they've increased. Sadly, a lot of times the people who end their lives, especially the young people, they weren't in my care previously, or they weren't enrolled in mental health services. So I personally have not seen the loss of young people's lives right now. And actually, interestingly, for a lot of fragile people, the pandemic has provided a kind of respite also of just being able to be home and away from the pressures of school. And we can all mourn the kind of the academic losses that a lot of our students had over the past year. And there are a lot of kids who benefited from not being under the pressure of school and the pressure of peers so much. But there's definitely been an increase. And part of the overdose increase has not just been increasing amounts, but the volatility of the supply as the borders were closed, and opiates and illicitly manufactured fentanyl became even more erratic in terms of its potency. So there are a lot more unintentional overdoses as well.
Thank you. Ken Barabee, do you have a question you'd care to ask? You have a few questions, Ken.
Well, the one that really matters is, in what ways do tribal medical traditions help or hinder your work?
I find, I'm sure there are some ways that it can get in the way, but really the vibrant tribal traditions are a real asset to people. And the Pasquayaqui tribe is really remarkable in how it's integrated tradition and medicine and modern integrative medicine. So we have on the reservation an alternative medicine clinic, which has a modern Western trained naturopathic physician, a chiropractor who also practices acupuncture. And they also invite up, which has been a loss during COVID, but ordinarily under normal circumstances, we have two different indigenous tribal healers come up from Sonora, Mexico, who are on site for 2 weeks every month. And it's a circuit. There's a couple of them who, they'll come here for 2 weeks and they'll go to the reservation or the tribal services in Guadalupe near Phoenix for 2 weeks. So it's a great resource. I can, sit down and have conversations when I am able to with the healers in different traditions, and we can help each other, because I think of the individual seeking health, or any individual, as being like a multifaceted gemstone, and you can't just polish one facet. So you may need medical interventions to polish one facet, and you absolutely need family and social interaction to polish another facet, and the naturopath can polish another facet, and the community connections and the tribal traditions and being aware of your history. I think where traditions could possibly interfere, as you asked about, could be sometimes, the loss, the disconnection from traditions that could help people make sense of things that they're experiencing. And I think other providers could justifiably say perhaps traditions get in the way of people adhering to medical advice. I don't think that actually has to be the case. I think we can work together really seamlessly. I'm mulling that over right now.
Good questions, Ken.
Very good.
All right, Carla Erb, it looks like you had a couple questions. Did you want to go ahead and unmute yourself and share those, or if you prefer, we can, there you go.
No, I just recently had sat in on some discussions about how many elders are living alone. And during the pandemic, especially, it increased issues of loneliness, which one of the interventions that I read about is something called like pet-like robots, which give the sense of company like a pet, but not one that you have to walk or take care of. So I wondered if you'd had any experiences with that, or if you've read about that.
I've only read about them. I think it sounds so sweet though. And I know there's very good evidence about them. So I don't know if anybody else here does have direct experience with them. I'd be really curious. I'd be Maybe I'll get one for my dad and see how he likes it.
I mean, I love my dogs, but I mean, not having to, clean up after them. I mean, I wouldn't mind that part of it.
Yeah.
Well, I guess part of the question is how do you, I mean, when people come to you for a sort of service, I mean, they probably aren't walking in and saying, well, loneliness is my problem. Okay. They're probably saying other things. So how does that play out?
Well, I certainly keep loneliness and isolation in mind and ask questions about, how often are you, or when was the last time you're able to connect with somebody else? I've seen some elders get pretty good with using technology, and a lot more people not get so good at using technology. And then we try to turn to, well, I like to ask questions in a style called appreciative inquiry, where you just ask, when was the last time that you felt really connected? Or tell me about a time that you felt really alive, and to try to build on that. And if, the last time somebody, oftentimes actually I can think of specific elders right now who the times they feel really alive and connected are when they're watering their plants and feeding their chickens and connecting with non-human life forms. And I think that there are a few people who could really benefit from those robot pets, though. I'm gonna have to look more into that.
Carla, you had a second question that I find interesting about, do your patients benefit from medical marijuana use?
Yeah, I wondered if that comes up.
Yeah,
I wonder if that comes up.
that does. It comes up a lot. It came up long before it was considered medical. So one short answer is, well, marijuana is another herbal product. I actually trained as an herbalist before I ever went to nursing school. It's a plant that human beings have used for millennia at least, with some good benefit. Everything can be abused. And the marijuana available today is vastly different from the marijuana available just 20 years ago. So people definitely can benefit. There's been a lot of transition from the daily use of opiates, where we've got, anytime that you have traumatized people, you're going to run into chronic pain. And it was completely accepted practice for far too long. There was never an appropriate length of time for this, but, it was accepted for people to be prescribed opiates on a daily basis. So transitioning to medical marijuana has really helped a lot of people for that. And then I do like to really encourage people to look for the products that are higher in CBD than THC, because the amount of THC that's in so much of the marijuana in the dispensaries or just on the street is much, much higher than it naturally was. Or I don't know if you can say naturally for something cultivated for so long, but people do benefit. It can really help with anxiety too, but that's tricky because people just think marijuana, it's marijuana, but there's, there are people and there are varieties that can really precipitate incredible anxiety and paranoia too. So if I had an hour to go on, I would talk about my specific concerns about the way marijuana is being handled, because it's not medical the way it's happening. If it were medical, I could look up in the prescription database, where I can look up, if you're coming to me as my client, I can look up and see how many opiates, how many benzodiazepines, and how many other controlled substances you've been prescribed by how many providers, and getting them from which dispensaries, which pharmacies. I have no way of knowing that with medical marijuana. And that's not about my control. Very oftentimes it's about patient education. I ask my patients all the time, how much do you smoke? How much THC do you think you're getting? They have no idea. And it can vary widely. And some of the products are incredibly potent. So I see people benefiting, and I see some people really able to harm themselves legally. So I think we have a huge learning curve into how to really use this as a plant that can benefit people without it causing more harm.
I found when, I think it was, might have been 5 years ago, I was trying to learn how to use it myself and not having much luck. Like if you go to a dispensary, you know, the bud tenders they're salespeople, but they're not medical people, not really. And I did a lot of reading, a lot of research to understand, well, how do you know what to use and how much to use and the different strains? And it took a lot of work for me to educate myself. Somewhere along the line, I heard of a medical marijuana coach in the southern Arizona, and I got his number and called him up, and for several months I worked with him to get better at, you know, figuring out how to know how much THC are you getting and how to control it, how to time it so that if you're in pain and you want to stay out of pain, you know, how often to take it. This is what I hope the medical marijuana field will come to, is having this kind of guidance readily available for patients and for practitioners like you, that it's more easily accessed than what it was for me. I consider myself an activist for improving medical marijuana education.
Wow,
and
great.
Improving the research. They haven't allowed enough research to come back and give accurate titration and dosing and that kind of guidance. So I think for me, I'd be interested in what others say. I'm very happy that the Daily Star is now doing regular reporting on medical marijuana. There have been 2 very informative articles that Eddie Salaya has produced, and especially the second one that talks about, I'm sorry to be going on.
That's great.
But the second of Eddie's article talks about the fact that there are topical treatments that you can use. You don't have to smoke, because many of the people I know are older who have medical marijuana cards. They don't want to smoke. They don't want to hurt their lungs. They want to have the dose that they need without taking too much. And I've recently, because I hurt my back about a week ago, I thought, you know, I just didn't feel like using medical marijuana every day because I had other things to do. It slows you down. I got some of a topical that worked very well, and you don't get high from it. There's no impairment. It just simply works on the pain. So, but these are things that, you know, I'm stumbling around over a 5-year period to learn all the things that I need to know to learn how to use it safely and effectively. Enough. I don't want to take any more of the time, but that's the kind of stuff that's on my mind. And if practitioners like you become more sophisticated, then you can help your patients more. And I hope that we're moving in that direction. And with Eddie's help and more people writing about it, teaching about it, I hope we can do that. Thank you.
Carla, just as a side note, I'd love if you could email me that contact of that person you contacted that helped educate you a little bit more, if you happen to have it. I'd love to pass it on.
I have it, yeah. Yeah, I'll send you an email, Sarah. Thank you.
Sounds good. Thank you. All right, so let's see. We've got some. It looks like Kathy Horton. She shared some in the chat. Did you want to unmute yourself? And
I was just making a comment. I was Palo Santo, sage, and holy water have become my friends lately. I'm a therapist. Substance abuse. Most of my clients are teens and transitional age youth. And yes, through the pandemic, I've become really understanding of all of the practices that I offer to my clients was really necessary for myself. Because this Zoom, like as you mentioned, Lori, it's crazy. I'm 12 hours in front of Zoom 4 days a week, and learned all about these new glasses from the kids at school, the blue light. So it's been very helpful. But I was just putting that out there, that it's just to preface that self-care is so incredibly important, not only now, but, you know, always.
Always. Yeah,
Yeah.
thank you. It's lovely to hear you talk about our plant friends.
Lori, as long as I unmuted, I wanted to ask you if you would speak a little bit more. You spoke briefly about the marijuana in terms of a lesser of the evils, right? When we're talking about opiates. So could you talk a little bit about maybe some harm reduction that you might be using in your practice? Other harm reduction?
Sure. And I'll say, I don't prescribe any opiates. I don't work on physical pain. So that is outside of my specialty. But I work in a specialty that has over-relied on benzodiazepines like Valium and Xanax and Ativan and lorazepam and everything else. So medical marijuana can be harm reduction in that, in that area. It's very difficult to have a lethal overdose of marijuana. And I also don't have any control. That's the other way. It's not medical. I can prescribe somebody a benzodiazepine and control how much they get and taper them off. And I like to think that people are comfortable enough to be pretty frank with me about how much marijuana they're using. But as Carla pointed out, it's really hard to even know how much THC you're getting. So I can work with people in terms of, that's fine if you're smoking a little bit more and you have, that's so tricky, actually. It's so tricky to say if you're smoking a little bit more, you can have less Ativan. Well, if you're smoking a little bit more, let's just stop the benzodiazepines altogether. And then I have no control over how much they're using. And, throughout most of history, people have had to be their own providers anyway. And I'd rather that they have more support. How else can it be harm reduction? In our opiate treatment clinic, we pretty much, we don't worry about trying to reduce people's marijuana use, because if we can get people off heroin and street drugs, then that's what's life-saving. And the more people get connected, as you clearly know, the more people are connected to meaningful activities in their life, the less of a draw the different drugs are.
So just for my own clarification, so when you talk about, when ones are addicted to some of those drugs and using marijuana, does that marijuana become like a transition? And then the goal is to be off of them, or is it to just transition off of those opioids and different things to the marijuana as a long-term, like replacing it almost?
Right. Well, once somebody's on medical marijuana, it's really up to them how much they're going to transition off of it, because then it's out of the hands of the prescriber. It's medical in the sense that you have to go get a card renewed once a year, where there's a select number of MDs who can sign off on your medical marijuana card. But after that, they don't control there's no prescription. So I think in terms of harm reduction, with the medical provider is able to wean people off of opiates and have that conversation that, if you're able to function, that's a key thing we have to look at. Do you have anxiety and do you have pain, but are you able to function? And if marijuana is helping them function more than they would without anything, if people are going to taper off of it, that's really up to the individual.
It looks like Beth Isabel had some that she shared in the chat. Did you want to unmute yourself, Beth? And there you go.
Yeah, thank you. First, I would like to comment on the marijuana articles. They're fascinating. And for those of us who know nothing about marijuana, maybe even though we were around in the 60s, we never had the opportunity or inclination or whatever. It has been really eye-opening. And I also especially liked the article on topicals. because many of us do not want those side effects. So that was great. But my actual question had to do with, I've often wondered about these pet-like robots. That's really, it sounds very interesting, and some studies have shown that they help as much as real pets. But have you ever suggested to someone who might be depressed or lonely during this pandemic time that they try a pet, try getting a pet? Because we have seen these dog adoptions, maybe cat adoptions too, just exploding over this last year.
Oh, I think, yeah, having your animal friends is invaluable. You can't beat it. And I actually have never recommended that somebody go get an animal, because, you know, I work with a lot of people who I am not too sure how reliable they are. I take it really seriously to take another creature into my care. But I have lots of people who tell me, I went and got a dog and it's made all the difference for me, especially teens. I'm not going to tell a teen they should go get a pet. That's something the parent has to be on board with. But once they do, I'm often asked to write letters saying, you know, this is an emotional support animal. So I have to be very clear that there's a difference between that and a therapy dog. I can't write a letter saying this dog gets to fly with you. But I can say he's an emotional support, and I am all for that, and I really encourage that. But I don't bring it up because I don't want to be responsible for somebody getting in over their heads.
What if they brought it up to you?
Mm-hmm.
What would your response be?
I would want to just have a conversation about, first of all, what's your experience with animals? What do you think they need? What kind of commitment could you imagine yourself making? And also make room for the possibility that things shift incredibly once you fall in love. You know, and we fall in love with our dogs and our cats and all these other animals. So you might have somebody who feels like, I can't feed another creature. Well, if they really feel strongly that they're not going to provide well, then I would not try to convince them otherwise, but to remind them, you know, it's amazing what you'll do when you have this cute little face looking at you. You might actually feel like getting out and going for a walk. And I would encourage people to think about, you know, just to spend time with animals, people that they know that have animals. How does it feel? You know, do you feel more calm or connected or playful when you're with these animals? Then, you know, maybe you want to find a way to spend more time with them, or maybe you are interested in volunteering at one of the shelters, or maybe you're interested in helping out your sister who's so busy taking care of her kids that their dog doesn't get a walk. Maybe there are lots of ways to look at getting involved with animals.
Thank you. Those are really good suggestions. And to bring up some of the things that people might not realize or think about, which is animals can be expensive as well. They get sick too.
Mm-hmm. And many of my clients have a ready-made opportunity to get a dog at any moment, because although the situation has gotten a lot better, there tend to be a number of homeless dogs on the reservation, so people can go adopt them. I've tried. So
I was curious, Lori, there's been a lot of controversy, you know, telehealth has become huge, you know, during the pandemic, whereas it was used lightly, you know, previously. But there's the debate, you know, we've had some articles we ran in the paper about, you know, okay, we're getting through the pandemic, it's time to get back to the doctor. I mean, I for myself have loved going to the doctor via telehealth during the pandemic, because I feel like I almost had more of their attention. It felt less rushed. I feel like we accomplished more, you know, during our visits. But there's such a debate, you know, on can you truly get what you need not being in person? I just wonder, I know you said you missed the, you know, being able to comfort someone, you know, by, you know, touch on the shoulder, you know, just what your thoughts are on that.
Yeah, I think that's such an important question to keep examining. And I don't know that we're going to arrive at a final answer, but I think what I know what we are doing in this agency is, maintaining telehealth as a regular, consistent option, and essentially moving towards requiring somebody to come in on an intermittent basis just to update everything. And that's still, I believe, to be determined how frequently we'll ask people to come in. Some people really can't wait to come in person and are coming in already. And I will say that the beginning months of the pandemic were overwhelming for so many reasons, but one of them was, in mental health, public health in general, there's a very high no-show rate, which allows you to really get everything done that needs to be done, because you'll have some free time when people don't show up. But during the pandemic, I found out if you don't just wait for people to show up, but you call them up, my no-show rate just disappeared. So I was suddenly, busy more than the 8 hours that I'm normally here. And that's been a huge benefit to people who have a hard time making it to appointments for a number of valid reasons. They're not just choosing to be lazy at home. There's barriers to getting here. So why not drive less? Why not, just make it lighter on the environment? And I'm able to touch base with the mom who's at work and the kids who are at home, and we're going to keep doing that. And I think we need to really be individualized in that approach. If you're treating somebody for, skincare, you might want to have them come in more often. But for mental health, we're definitely going to integrate both options.
It's so great to hear, because for some, they do need to come in, but for some, I think they might actually be more prone to just, instead of, having to get there, but I can just do it right from home. They might be more consistent.
Yeah. I was very skeptical when I attended trainings advocating telehealth, and they would say, actually, some people will open up more to you with the safety of the screen. I was like, yeah, you guys are just selling a bill of goods. But it's true. A lot of people do open up more online.
Yeah, definitely.
I have a question. I'm curious, from your experience on the res, I know I'm asking you to generalize here, which is a sin, but what would you like outsiders, policymakers, folks to know about the humans on the Pascua Yaqui Reservation and their lives?
That's a very good question.
Are they much different from our brothers and sisters in the same economic strata? Or do they suffer more or less?
I will have to answer that the best I can, very humbly. Never having existed as a Pascua Yaqui tribal member, that is a history and an experience that I've observed and not experienced directly. And, yes, they are very much like our brothers and sisters of all walks of life. We have tribal members who are published researchers. We have tribal members who are physicians and artists. We have tribal members who are living under the bridge. We have, just like with any population, there's a huge variety. And of course, socioeconomic barriers affect people regardless of the color of their skin or their family history. And those are huge on the reservation. And the generational trauma is immense. And that's something that is difficult for us to address in society as a whole. And, we are sitting here although it's hard times, we are in a thriving society, and we have the blessing and perhaps the curse or the challenge and the opportunity of living in a beautiful land that we took by force. So it's kind of easy for a lot of us to go throughout our day just enjoying without even recognizing the bounty that we have. What would I like you to know about people living in New Pascua? So it's pretty cool, actually. In some way, I mean, I first started working there in 2011. They've really done a lot with the infrastructure. I have great respect for the tribal council's decision long ago that all the profits made by the tribe are reinvested in community infrastructure. So they've got a beautiful new Head Start building, a beautiful fire department, and library. And every time I drive down there, I now work in a satellite clinic in town, but whenever I drive down there, I feel like things are always a little more polished up, nice sidewalks and streetlights, and new housing that meets people with lots of different needs. So they are a community trying, like we all are trying, to do the best we can for ourselves and for our loved ones.
Thank you for that. Okay, Brian, it looks like you have a question. If you want to go ahead and unmute yourself.
Yes, I was wondering if you see a mental health improvement in any of the people you work with if they have begun to study their native language more and get in touch with their cultural roots. I don't know if how much of that was destroyed by the old policies and how much it's rebounding, and if that makes any difference to your therapies.
Mm-hmm. Oh yeah, that's huge. And it's actively supported and advocated and built into the structure of our healthcare system. And I am no expert on the history of the Yaqui people, but I think it is complicated a bit by the fact that the traditions were interfered with. You know, some of the earliest interference happened, you know, with the Catholicism of tribal practices. Yeah. So there's a huge return to it. I see kids who you can do a lot to motivate an unmotivated kid when Lent is coming, and their participation in the Lenten ceremonies depends on them shaping up and improving their behavior. They're motivated. And learning the language is common. And yeah, all these things are really helpful and great to see.
Oh, I'm very glad to hear that's integrated into what you're doing. That's fantastic.
Yeah.
Thank you for that question, Brian. I was kind of thinking something along those same lines about there's been a stigma for so many years about mental health. I know for myself personally, I was raised, I'm a little surprise baby, so I'm quite younger than the rest of my siblings. And so my parents are of a generation that, you know, I love them, but they were raised with this mentality of, if I can't see the broken bone, there's nothing wrong with you. You know, that kind of thing. You know, you can't see depression, you can't see anxiety, you know, and with how they were raised in their generation, very much just not the lack of acknowledgement of mental health. And so I wonder, there's been so many movements toward, you know, people being more understanding and accepting of mental health, and just wondering, you know, we feel like we make strides, but you being in that profession, I mean, what do you think is happening with that? Are they improving? Have we made any improvement?
Mm-hmm, mm-hmm. I think in some ways we've made improvements, and maybe sometimes in the wrong ways or the wrong areas. So what I think of is, yeah, my own history where mental illness of family members was really well swept under the rug, but then we had this very bumpy rug, right? Nobody wanted to talk about it and acknowledge it. And now, you know, I see in my parents much more willingness to say, yeah, our son had schizophrenia, and to not have to try to hide it. And that is the area we need to keep working on, because there still is so much fear, I think, surrounding that. And my personal belief is that some of that fear of dealing with people who are severely mentally ill, it has to do with when people are unpredictable, it's frightening. And I think that we all fear, what if we could go off the deep end? You know, it's hard to see other people experience that. And then on the flip side of it, I think we've managed to eliminate stigma in such a way that there's an overdiagnosis, an overpathologization. Is that the correct part of speech? Pathologization. Anyway, you're the language person, so
I'm not going to correct you.
We've got to use that word in a sentence somehow.
Right. We're stamping this label of pathology onto things that are really just a part of the full breadth of human experience. We all have times of feeling so down. We all have times of doubting that life is worth living. We all have times of intense anxiety and dread. And we all have times of mild anxiety. And when I worked for campus health at U of A, I felt like I had to almost promote a stigma in a little way. Like, come on, you don't have anxiety, you're worried. You're worried, and this is how we deal with anxiety. This is how we deal with natural worries. Of course you're worried. You're going to stand up in front of 200 people and talk. So we don't need to, and I see younger people labeling these behaviors or feelings as diagnoses and owning them. My anxiety is bad today. My depression is bad today. Like, you don't own this depression, it's you. You're the human, you're the individual in charge of your life, and you have these feelings that we're going to learn how to work with. But rather than that, we have people who've grown up at a time where, you know, Prozac has been advertised directly to the people for a few decades now, and all the other antidepressants you could use. So it's very easy to grow up thinking, oh, my anxiety is bad. I need to get the right pill to fix my brain chemistry because it's messed up, because I'm feeling emotions that are less than pleasant. Wow. So
I'm sorry to be stunned by this, but this is kind of wonderful to hear. Because you've managed to describe something I think I've experienced, some acquaintances and friends, and I've probably engaged in myself in the course of my lifetime. Just, you know, sort of making a psychological diagnosis of a stranger in 20 seconds. But I'm sure we all do it to ourselves with great frequency. What an interesting kind of problem that creates.
It is, yeah.
Oh, wow. Do you think it's just the way our culture is? In a way, it's just almost inevitable.
No, I don't think culture is ever set in stone. I don't think there's anything inevitable about culture. We create the culture. Diagnosis and treatment is profitable business. I think there's a tendency, and it's evolutionary normal. It is evolutionarily normal. Like, we need to zero in on the problems, the dangers, and the threats in our environment if we're going to survive. So if we perceive our own psyche to be part of that danger, we need to focus on it. And, oh my God, there's something wrong here. But we're very good. We've had all of human history to learn how to spot problems and to really focus on them. But we are at a time where I think we really need to spot solutions in our own selves and our own psyches, and notice, like, oh, I do have a lot of anxiety, but I'm the only one who never misses the bus. You know, that's kind of a simplification, but what is the benefit that your anxiety possibly brings to you? So I don't think it's
the positives. Is that kind of, you know, finding the positive within the negative feeling?
Sure, right. What if everything has a light and a dark side, or two sides of the coin? Let's flip it over and see what the other side is.
Well, I noticed the chat, Beth Isabel has an interesting, relevant point. Beth, you want to unmute yourself and share your sentiment?
Sure. Yes, lately with all of this talk about my anxiety, my depression, and I hear it a lot from friends, relatives, etc. And even to me, if I express a worry or anxiety, where did we get this idea? Oh, social anxiety, that's a bugaboo. Where did we get this idea that we need to be happy all the time? There's something wrong with us.
That's a great question. Where did we get that? And are people, I mean, how often do you hear people say, oh, my happiness is just out of control today, and my fearlessness is great, and I'm just living life, or my inner peace is really dominating today. You know, people don't seem so ready to just stamp and own those more favorable sides. So where did that come from? I mean, I have lots of ideas about that, but maybe I won't launch off into that right now.
All right, let's get another question from Brian as we're winding down. Go ahead and unmute yourself.
I was just wondering if we ever did get to a point where we had universal health care that included mental health, would you advocate for people getting like a mental health physical on a regular basis? Would that be something, would something like that actually be useful, or would it still be more appropriate to address a problem as they come up?
That is such an interesting thought, especially following the discussion of like over-identification with pathology. So I mean, preventative health is the only way to go. But I'm not sure how preventative it would be to have somebody sit down with somebody whose whole training is in finding pathologies and labeling and diagnosing and treating them. I think we could do a lot. I mean, the other great thing about working for the Pascua Yaqui tribe is it is universal health care for every enrolled member. And nobody pays for their psychiatric medications. It's the way it should all be. Yeah. That's what the American Nurses Association has advocated for decades. But I think preventative, like regular checkups, are a great idea, but they should be administered, if I run the world, they should be administered with a positive focus that's real, that's authentic. Yeah. It's not just making things up, like you're a good job, good kid, great try, but very specific. You know, I noticed that you are very attentive at doing this, and this is what you succeed at, and how are we going to build that? And the method of appreciative inquiry, like when do you feel really alive and really purposeful, and how can we build on that?
Because I was interested, like what you said about the current crop of people out there that are mental health professionals are met with dealing with pathologies, and it would almost require something like a family practice, mental health kind of person to do these kind of wellness checks kind of thing, as opposed to like, okay, you have a problem, so let's get in there and diagnose it kind of thing.
Well, that is integrated into a lot of practices. A screening tool called the PHQ-9 is administered at a lot of well checks to kids and adults. It's a pathology-focused screening tool that is not going to come up and say, oh, you have a positive attitude, or, you know, you have some anxiety, but you're working with it. It's pathology-focused, and you know, family practice is so under so much pressure, and they have so much to do in such a short period of time that if they see a high score on the PHQ-9, they're not going to take the risk of doing anything less than referring you to the psychiatrist. Yeah. Of course, how soon you can get into the psychiatrist is a whole other can of worms. Yeah. But if a kid endorses suicidal thoughts, they have to refer.
Yeah. Absolutely.
Yeah.
Well, I think we are unfortunately at the end of our hour with our wonderful guest, whom I couldn't resist.
Oh,
there you go.
Oh, you're very good at multitasking.
Thank you.
Asking those
I was
questions?
going to say, it's because I decided to forego my Ritalin today.
Awesome.
If you guys could only join our daily staff meetings, you know, we don't get completely dressed up like we do for you guys. And Fitz draws our picture. Like
You'll get this. You'll get this via email.
Wow, thank you.
You are
That's
welcome.
awesome.
Thank
But
you so
thank
much.
you so much for joining us today, Lori. I think you've definitely given us a little food for thought, not only, you know, with all of us as individuals in our mental health care, but also what's going on elsewhere and what others are dealing with. So we thank you for your time.
Well, thank you so much. I really enjoyed this. Take
Alrighty,
care,
and just to
everybody.
give you all a preview, so next week we have Michael Ortega, the Tucson City Manager, joining us. So we look forward to, I'm sure we're going to have a lot of questions for him. So let's start thinking about them and bring them all next week. But we thank you guys all for joining us so much. And for the Arizona Daily Star, I am Sarah Brown and joined by David Fitzsimmons. And we look forward to seeing you next week. Thank you all.